I'd like to welcome everybody to today's session, Gray Literature Resources to Support Emergency Preparedness, Response, and Recovery. My name is Sarah Levin-Lederer, and I am an Outreach and Education Coordinator for NNLM New England region. And with that, I'm going to turn it over to Cecilia, since she is going to be introducing herself as she goes as well.
Good afternoon, good morning, wherever you may be. Thank you so much for joining us this afternoon for this quick dash session. As Sarah had said, my name is Cecilia Burns, and I am part of the NNLM in the role of Education Coordinator for the Public Health Coordination Office, as what we are now called the National Network of the Library of Medicine. Our office is based at the University of Massachusetts Medical School in Worcester, Massachusetts. And I have been part of this office for about 3.5 years, focusing on serving public health departments that are part of the Public Health Digital Library program. Just to clarify a few things about this webinar, it is part of a series called the Public Health Webinar Series hosted by NNLM. And although our focus is the public health workforce, everyone the sessions are open to all. So this is one of the series. The next webinar is coming up in November, and if you'd like to access the recording of the first of the series, that's available at the link displayed on the slide on YouTube. Our upcoming series scheduled sessions will be listed on the link displayed also on the slide under the nnlm.gov calendar or classes listing, Public Health Webinar Series as listed here. And just to clarify, if you are a member of NCHEC and have CHES certification, you can apply for continuing education credit by completing the evaluation following today's session. You will thus receive 0.75 credits for this session. And again, as said earlier, no MLA CE credit is available for this particular session. I mentioned the Public Health Digital Library just a moment ago in my bio description. I just want to clarify, this is a network of public health departments across the United States that have agreed to participate in this program on a subscription basis, where approximately 300 journals and about 8 or 9 databases are made available to departments that are accessing resources from the program. Currently, we have about 27 members. We hope to grow in the future. And most of our membership is state-based public health departments. To clarify for today's sessions, even though I'm part of the PHEgov, we're focusing today on gray literature. We'll be discussing examples of what gray literature actually is. We're using a couple of different definitions, looking at some traditional, what we call traditional examples, some non-traditional examples, and also looking at what could be used as potential sources for finding gray literature, and then finally describing how gray literature can serve in emergency management preparedness, response, and recovery phases. This course outline is going to go over the sections of the theory basis discussion. I'll be presenting a few of the sources, and then my colleague Sarah is going to take over and show concrete examples of gray literature that focus on emergency management preparedness and response. So we think of gray literature. The term gray seems to be kind of nebulous in its own way, but we do have what are called some working definitions. Periodically, there's a conference that gathers, and they tend to redefine gray literature based on the conference gathering. So from 1999, the definition encompassed that which is produced on all levels of government, academics, business, and industry in print and electronic formats, but which is not controlled by commercial publishers. So in this definition, we're speaking of material that is not in the published domain. In 2010, the definition shifted and became a little more evolved, and I suppose gray literature stands for the manifold document types produced on all levels of government, academics, business, and industry in print and electronic formats that are protected by intellectual property rights of sufficient quality to be collected and preserved by library holdings or institutional repositories, but not controlled by commercial publishers, i.e. where publishing is not the primary activity of the producing body. So there are deeper discussions that can be had about definitions of gray literature, but for today's intents and purposes, these are the two that I think are most current and at the moment accepted. So just to be brief about it, the idea of gray literature, we're looking at material that's not in the published space. So it can be based on definition, it can be recorded, it's referable, it's sustainable. This can also include data. There's a whole other area in the domain of gray literature discussing gray data, white data, black data. That's a whole separate discussion. But as we get more data-driven in research, policy, planning, it's important to make sure that we have that idea of data in our definition in the space. We want to look at the value of the literature itself and make sure it's publicly available. Gray literature tends to be publicly available, but not always easy to find. And also to know, since it's not going through a traditional academic publishing phase, it's not going for a review process. So the other characteristic of gray literature is something you want to be evaluating. So for example, if you have a preprint, you want to be looking at specifics of the methods of that particular academic paper that has not yet been published, and that's considered gray literature. And in particular for this time of our pandemic, preprints have become a go-to source for very quick information, but we have to remember they're not peer-reviewed, although they've been getting referenced a lot, especially in the mass media. Sometimes gray literature can be difficult to find, other times quickly available online. So you have this juxtaposition of, is it easy to find, hard to find? How valid is it? It tends to also have no commercial source. It may also be in a limited distribution. And when we think of gray literature, we start to think immediately of types of materials. So conference proceedings. These would include the abstracts and the papers. We also mentioned preprints already. Theses and dissertations are also considered gray literature, so are patent databases. And thinking more outside the box, looking at non-traditional sources, we can think of blogs, emails, even phone calls and text messages, toolkits, PowerPoint presentations, webinars such as this would be considered gray literature. I mentioned earlier that there's a concept of gray literature also including the domain of what's preprint. I just want to briefly discuss the difference between preprint and published. These are just two examples on the slide. We have on the left the medRxiv, which is a preprint server for health sciences. On the right-hand side, I have a screenshot from the Litkovid website that was created by the folks at NCBI that contains links to literature based on category of articles that have been published focusing on COVID-19 and SARS-CoV-2. So as we said earlier, preprints are not peer-reviewed. And where this issue of peer review gets thorny and journals itself, we can also discuss the idea of predatory journals, but that's another piece of the conversation when discussing gray literature. So we mentioned gray literature, so why would we use it? Why would we source it? Well, in the beginning of this slide of discussion, when you're discussing gray literature, you look at it as being, in some cases, readily available because the publishing process can be lengthy and the gray literature is made available, if it's a paper, the preprint, before the publishing and peer review process has taken place. So it's newer information available more quickly, such as in a public health emergency. Another thing that's unique about gray literature, it may be specifically targeted in a specific population, policy, or program. Also, it may be local. There may be regions that are geographically based. They're working on specific topic areas. So the resources coming out about that, policies, reports, white papers, may be locally specifically focused, more quickly accessible. Another reason to use it, you could have access to more data. So if you're working on a systematic review, you want to consider gray literature to be part of your search because you'll have access to more data. You'll also want to have access to more current research, and again, because of the publishing process, preprints tend to be the way to go with that. In some cases, gray literature is available at, in many cases, minimal or no cost, and as we know, publications, that's a very different thing, trying to access published articles. Another reason you might want to use gray literature is to find collaborators. In some cases, look at the authors who are working in the same academic or professional spaces, so you can collaborate either across departments, across your state, or even across the country. Another thing that comes from gray literature, or why you want to search, is to see what the new trends are in research and academia that are being worked on. It's good to see what the trends are, to see what you want to focus on with regards to your work. And then finally, gray literature is really good to have access to when you're dealing with an outbreak. So here I've just specifically listed some domains where you could search for gray literature. I mentioned dissertations and theses databases. These would also include institutional repositories that in some cases have articles that are freely available that, again, have not yet been published in the general domain. You might want to search your conference pertaining to Web of Science or through any other database. You could look through ProQuest. Government websites are also an excellent source of gray literature. And these are not just the national government websites or federal, such as CDC or FEMA in this case, but more targeted public health departments or even association websites are super helpful. Google Scholar is another source, another excellent source, nonprofit websites. And then finally, something that not everyone thinks about are massive open online courses, such as the organization TRAIN provides those freely to public health staff and workers. And finally, I want to give a quick mention to news alerts. More and more, we are becoming dependent on information being given to us based upon alerts coming through our mobile devices, whether it's a tablet or a cell phone. On the left here, I have a screenshot of an app called Smart News that just shows you what a news alert tends to look like. What it is that when you're using news readers, the actual individual uses of what you read, not just how you read it, gets reflected in the back of the app. And those topics that you tend to focus on tend to reappear because the app is, quote unquote, learning what you like to read. So on the right-hand side, I have created a very simple, rudimentary flowchart of what the background idea is of this concept of you reading an alert, reading an article, and noticing the keywords and phrases that are the metadata for that record of that article. That metadata is collected in some shape or form, and then you have sets of terms that get joined together, and that's what these plus signs with circles are. And that tells the SEO, the search engine optimizer, well, this other set of articles might also be of interest. So we're going to send those through to the user so that they could actually start reading them as we think that's something they would want. Now, there are ways you can set up more generalized news alerts for things like Google News and other apps. But as far as your level of usage and engagement with the back end, this is something that's done automatically in an algorithm in a black box sort of space. So it's harder to control what's going to come up in the newsreader. So unlike our uses of Mesh, where we can select searching on a major topic through Mesh, here we're not able to select what those keywords are in our search. So in this case, it's our behavior of using the device that drives what comes up. And sometimes when you start to do this, you'll start to get news alerts that reflect topics you're interested in. And by that token, sometimes those articles are discussing preprints that have recently been made available that are pending publication. It's another reason I brought up this particular topic. And finally, just some additional places for resources information, such as the Gray Literature Report, World of Science, Open EU. And also, I want to make sure to mention PH Partners, which is grown out of NLM especially, as that is a more focused website for public health workers and professionals. And I believe it's time for me to switch. So give me just a moment here.
So I have taken back the power.
Okay.
And
I'll go ahead and mute myself.
Yep. So Cecilia was talking all about, the theory, what is gray literature, and it may have stirred some, thoughts that you had about gray literature that you're already using. So just since we will have plenty of time for questions in the chat box to make sure everybody can find that, are there sites that you're using that you're now saying, hey, that's gray literature? So on the screen now is those types of gray literature, so blogs, email, phone calls, text, toolkits, PowerPoint, presentations, tweets, webinars are the non-traditional, the more traditional being conference proceedings, preprints, theses, dissertations, clinical trial registries, patent databases, government documents, agency and government reports, guidelines, data sets, anything that sort of you say, oh yeah, I use such and such, and that's gray literature. So Julie said, are in-process research projects such as information found on clinical trials and HSR Proj considered gray literature? Julie, you actually are not a plant, but it's going to look like it in a second. Corey said, I use government documents and guidance daily. Yeah. So on this slide, you can see that I've highlighted some of them, and that's because I'm about to go through some concrete examples of ones that you maybe already use, and then ones that you may not use but might start considering in the future. So with that said, Tom says, librarian listservs where I find information on how public libraries are dealing with COVID regarding quarantine materials, etc. Yeah, so those would be considered guidelines. They're not necessarily the clinical guidelines that we're often thinking about, but getting resources and guidelines from other institutions and using those to prop up or to support why you do certain things would also be considered gray literature and a use for gray literature. And Corey says, and sometimes you can find pure gold in other people's PowerPoints. Yeah, so that's also another thing, part of gray literature is this idea of not reinventing the wheel. There's a lot of information out there that's not necessarily published, but somebody else has already gone through and done some of the research and things like that. So, and this is why Julie is going to look like she was prophetic or a plant, because I'm going to start with clinicaltrials.gov. Clinical trials is, as the name suggests, a clinical trial repository. So, it falls into that sort of traditional traditional gray literature list that we had. And so, it's a way to just search ongoing clinical trials if you're a patient or a family member who's looking to get involved, but also for providers and also for researchers on a way to stay up to date on developments, find collaborators, and then also identify unmet needs. So, the first one. The next one is NIC-HSR, which is the National Information Center on Health Services Research and Healthcare Technology, which is an NLM product, as is clinicaltrials.gov. Under NIC-HSR is the Health Services Research Projects in Progress. So again, like with clinical trials, it's a way to find collaborators. It's a way to find research that's already being done. It's a way to look for unmet needs. And then the health services / science research resources is a place to find data sets for health sciences, so for public health and social and community interventions. And then Cecilia mentioned partners in information access for the public health workforce. This is a place that has a lot of information about training and things like that, but it also has pre-done searches for the healthy people objectives. So, you know, I'll mention healthy people later because, you know, data sets was one of our gray literature areas, but partners and information access, so PH partners is a way that we can already go in and find those searches that have already been done. So we don't have to, again, recreate the wheel. We can find those data sets. We can find the information, the corresponding information on PubMed, which I will not be mentioning because that is the other side, the commercially produced side. So there's another example. Cecilia mentioned TRAIN. Webinars is one of our gray literature areas. So TRAIN is a national learning network. And there are many free public health focused webinars from trusted institutions like the CDC, FDA, state and local health departments, and others. And then they also have their COVID trainings that are available. So again, when we're talking about how do we use these resources in an emergency, you find the partners who are doing this work, are making it available and sharing it. And so again, you can go in and find it and have it in a timely manner without, again, having to reinvent the wheel. So then we also talk, government documents and reports are a huge area of gray literature. So in an emergency, FEMA is going to be one of our big gray literature partners. And it's probably, again, resources that you're already using, but may not have thought of as gray literature. So you're looking for that information on local disaster declarations. You're looking for the resources for recovery available to your community. And that's including money for grants for businesses and families. FEMA also then has planning frameworks and exercises and continuity resources. So again, when we go back and think about what our gray literature types are, we're looking at things, government documents and reports, so the disaster declarations, and then we're also looking at those templates and those trainings. Another example for when we're talking about emergencies is PHEgov, which is the Public Health Emergency, which is under ASPR, so the Assistant Secretary for, sorry, ASPR is the emergency, no, sorry. But it's under ASPR, which is the Assistant Secretary for Preparedness and Response. You know it's going to get there. So again, this is in an emergency. We're looking for up-to-date information. We're looking for the newest guidelines. We're looking for the newest reports. We're looking for the newest numbers and the numbers that are being updated regularly. So PHEgov is going to give you those most recent information on declared disasters, the emergency declarations, and then also the legal authority that underpins those. Again, the available resources that are available for communities and states, and then ongoing response and recovery action. So what are people actually on the ground doing to respond and to recover from an emergency? The FDA also, you know, again, we're on those guidelines for agencies and reports. I think because of the COVID situation, we're thinking a lot right now about how are we responding, what are we doing, where's the information for that. But we're also, you know, thinking about, okay, so if we're talking about the FDA, we also are thinking about recalls. So food and product recalls and warnings, those are guidelines, those are agency reports. They're also the regulations, rules, all of those would fall under the guidelines. And then they have trainings as well. So the CDC also, again, could have been listed for many, many different things, including training, data sets, the guidelines that are shown here. So specifically, when you look at what the CDC does and then what they produce, they're basically producing gray literature all the time. And it's there for us to use to support the work that we do in terms of emergency response and recovery. So specifically, this example is the CDC has put up guidelines for response to hurricanes and also with the wildfires that we're seeing for people who need to shelter, but also need to take into account the COVID-19 situation. So, like I said, the CDC could have been listed for many of our different types of gray literature, but to also think of the CDC as a place for guidelines and guidance. Healthy people, so our data sets were one of our types of gray literature. So healthy people, now we're on to Healthy People 2030, 10-year measurable public health objectives and tools to help track progress towards achieving them. So those tools and the tools to help track progress then are our data sets. You can go in and you can see, you can compare your state, your community to the benchmarks. You can look at, healthy people can also act as somewhat of a guidance as well. So what are the priorities that have been identified, and then where is the information, where are the data sets? So again, census data. So we're again talking about the data sets, and a lot of the healthy people data is being drawn from the community and household surveys that the census does. So, but the very useful thing about the census right now is that they have now moved to a new interface for their data and for showing their data. So they're now at data.census.gov. It's a new interface for filtering and comparing data. There are profiles. There's geographic. There's ways to display the information geographically and compare them that way. And then when we're talking again about preparedness, census data can help us understand our community. We understand our community by working with them. We also understand our community by looking at the hard numbers. So looking at the language needs, looking at age, disability, and other aspects that would, for our vulnerable populations, making sure that we're planning for them and having appropriate interventions and responses. So then tweets were also one that was mentioned. And so one of the things I wanted to mention is that tweeting can be, or social media, not just tweets, but social media as a whole can be and should be a two-way form of communication. And that two-way form of communication means that you can communicate to the people that you serve, but then you can also use it to take the pulse of what's going on in your community. And so that's where that gray literature aspect comes in. You can look at what people are saying and get a real-time, on-the-ground idea of how people are feeling, how they're acting, what they're seeing. And so this graph from the Pew Research Center social media fact sheet for June 2019, of U.S. adults, 72% use social media. So, making sure that we're using all of our avenues to pull data from our community and then use it to our advantage while responding to an emergency. And so then again with social media, because it is an evolving situation, we want to make sure that we're evolving with what's actually going on, what we're actually seeing, what the changes are, all those kinds of things. So in that vein, Asper Tracy, so Asper Tracy is Asper's training center, and they have a specific social media and emergency response I guess you could call it sort of a fact sheet, but or a list of resources that are under there. So webinars, fact sheets, training kits, templates, all of these kinds of things available from Asper Tracy and from partners, trusted partners such as the CDC, FEMA, Red Cross, to both help us communicate better in an emergency and then also make sure that we are effectively getting information from our communities in emergencies. So that was a very fast overview of gray literature, including some specific examples of gray literature that you may already be using and to sort of start thinking about it in a different way. And then also start thinking about sources of gray literature that you can use in a concrete way to both plan for emergencies and then also respond and during recovery as well. So we have sorry, I'm trying to read the chat box as well. So Peggy said that MedEd portal is also a good gray literature source. Peggy also mentioned NGOs and white papers and policy papers, so that's not something that I gave an example of, but lots of organizations are putting out white papers and policy papers, which are also sources of gray literature, especially in the planning phase. So when we're talking about how we plan and the kinds of the policy that's put in place, other organizations having done the research for their own communities are a source of information on what we can also then adapt for our own communities as well. So, Cecilia, are you ready for questions?
I am. We have at least 10 minutes, so.
Yeah, we have a lot of time for this. So first question from Catherine. If gray literature is not peer-reviewed, how do we know what we're reading is true and valid?
That's an excellent question. This is where having knowledge about the topic, but also understanding how to read the gray literature and what aspect you're coming from. So are you reading it from a perspective of implementing, or in cases of medicine, treating, or advising someone on this is actually a good source for following up on some sort of treatment or protocol? Really depends. If looking at, for example, if it's coming as a preprint, which laboratory prepared it, how many participants were in the study, what is the actual outcome that's being searched for in the study, if it's a study that's a preprint. And then as far as other gray literature, you're using skills of looking at the authority where it's coming from. So for example, it's coming from a nonprofit or an organization that works in nonprofits or consults with nonprofits. You would look at their track record of publication and other reports that they've worked on in the past, potentially what other outcomes they've had from having either implementing policies from those reports or government literature. Yeah, you don't always know if the gray literature is from a source that's either valid or considered authoritative, and that is one of the challenges of gray literature, especially if you're looking at non-traditional sources, things like Twitter, blogs, even emails, and that sort of thing.
So I would also add, if you're looking at data sets and some of the preprints, making sure you're looking at the methods and the other things that you would use to judge peer-reviewed studies as well. You know, you want to make sure that if that information is available, you're checking on that. You're looking into methods, where the information came from. You know, all of the things that you would use those critical thinking skills on other papers, but also to realize that sometimes you have to use your best judgment. So from Tom, he said, I can't think of any, but are there any gray literature that are still used that are in print? I recall 20 years ago, some newspaper clippings were considered gray literature, maybe more like 30 years ago. That's all his comment. I'm not editorializing on the time for the Cecilia, thoughts on gray literature in print?
Gray literature in print. It's actually a good question. So you're looking at preprints, you're looking at conference proceedings. You know, conference proceedings used to be in print as well. And now many of them tend to be online, but those are still going to get indexed. Yeah. Yeah, I didn't quite understand the question. Can you repeat that? Sorry, I was trying.
So, so Tom was saying that about 20 years ago, maybe 30. Cecilia, there's a feedback.
There's feedback? Okay, I can mute myself.
Thank you. So Tom was saying that maybe 20 years ago, maybe 30 years ago, that newspaper clippings were considered gray literature. And so, you know, there are some things that are now online that used to be physical, like you were saying with the theses and dissertations as well. And then, you know, where are there any gray literatures that are still used that are in print? Was sort of the upshot of the question.
Okay, now I understand. Like I said, conference proceedings, I believe, still are in print, but I would have to look at all the sources. We can look back on our slides here quickly and see of the types what could be considered in print. Theses and dissertations used to be in print. Those would get, you know, deposited with usually the library upon completion of a defense. And I believe some libraries still keep print copies. I'm not sure. I believe white papers used to be in print as well. But yes, I do believe that just because it is considered gray literature doesn't mean it's going to be all online. In the past, it was definitely print. So the idea of using the term print as published might be a little confusing. So just because it's in print doesn't mean that it's not gray literature. So again, when you're looking at gray literature, you want to think about the source and the authoritativeness of the source that's published, that's making that gray literature available. So I would imagine like a patent database probably has print copies, but now it's online. It's considered gray literature.
So the final comment on that from Tom was, we used to have file cabinets filled with clippings, etc. We called it gray, but maybe it wasn't.
If it was in a published domain, then it was probably not gray. But from aspect of gray literature, looking at it from an academic perspective, if those clippings were referencing articles or research that was either about to be published, then maybe that content it was talking about was considered gray, but the media article about it was considered outside the domain. I'm not sure. That's a good question. I'll have to ask another librarian who's been around longer.
So from Aaron, can you define preprints and their importance to emergency preparedness?
So preprints, and this is just, I'm looking up NIH's kind of aspect of it, they're typically manuscripts. So these are manuscript, meaning an article that has not been published yet, that's in the style that's going to be submitted to a peer-reviewed journal, but has not been subjected yet to peer review. And for an example of that, I can give you the link for the NIH preprint pilot that is currently going on. Now, we usually think of NIH, i.e. PubMed, having citations in the database referencing published articles, but now there's a pilot going on that's part of the NLM focusing on preprints, meaning these are pre-publication manuscripts that are resulting from research funded by the NIH, and they're being made available in PubMed Central. So the link that I just posted also has a lovely definition of preprints. It's probably way better than my own. So feel free to share that amongst your colleagues at your institutions, as it's quite a good website describing what it actually is and what the project also entails as far as PubMed Central is concerned and the NLM.
So then for the second part, the importance to emergency preparedness, that would be the fact that it takes a while for things to get published, and it means that people can have access to this information sooner with the understanding that it hasn't gone through the full peer review process.
Correct. And in response to that, I'm going to post here also the link to Litkovid, which ironically, Litkovid was created for the purpose of enabling published articles covering COVID-19 to be publicly available and also categorically searchable at a much faster pace than is usually set up. But because there's such a need, NLM and CBI sought to create this resource and make it very more user-friendly. And they have over 50,000 citations listed in this database.
So Julie asked, can you make the distinction between gray literature and gray data?
Yeah, that's what I was looking up while you were chatting. So when you're thinking about data group gray, it's material. In some cases, they're saying metadata, data about the data that's been generated with regards to gray literature. This is an area that still is getting definition. And to be truthful, I'm not an expert on this, but I could provide some resources later that cover it in much more detail.
So we can send those links with the slides and the recording. So some of the things that get a little bit more in depth on these things. So to respect everybody's time, I'm going to put the link for the evaluation in the chat box. It should also pop up when you close the session as well. There is one more question in the chat. References. So this is Cecilia's contact information and mine. If there are any questions, please feel free to reach out to us. Again, you will be getting the slides, so you will have our email addresses and all of the links at that point. So one last question, Cecilia, as folks are signing off.
I see where professional practice magazines fall into the category. I would say yes, they absolutely do fall in the category of gray literature. But actually, let me rephrase that. Professionally, are they published? If they're published, they're outside of the space because we're looking at materials that are before publication. So for example, it's a newsletter and it's published on a web and it's listed on a website, then that will be considered gray literature. But if it's a published professional, like the Groundwater Association magazine, probably not in that space. That doesn't mean that the information in it is not valid. So it's a fine line. And if it's in an EMS magazine, professional magazine, I would imagine that's going to be made available more quickly than if it were in a traditional academic published paper.
So from this discussion and the discussion of newspapers, I'm hearing that there might be some more need for some discussion on those fine distinctions. But we are out of time for today, so thank you for your time. And if you have any questions, feel free to reach out to us, and have a good afternoon.